So, you have a patient with opioid use disorder who is ready to begin treatment. This is great news. They prefer to have you prescribe their medication instead of going to an outpatient treatment facility for methadone. Absolutely no problem. You've read up on initiating buprenorphine and naloxone film and begin explaining the next steps to the patient. You get to the part about them waiting until they are in moderate to severe opioid withdrawal prior to taking their first dose of buprenorphine. Wait, what? Let me think about that, your patient responds. We hear this frequently, as we're sure you have. Now, we have an alternative method for starting a patient with opioid use disorder on buprenorphine-containing products. Microdosing buprenorphine, sometimes called the Bernice method, involves the patient continuing their previously used opioid as buprenorphine is slowly introduced at the same time. Numerous suggested protocols for microdosing do exist, with most starting with 0.5 milligrams of sublingual buprenorphine naloxone on day 1, followed by 1 milligram on day 2, 2 milligrams on day 3, slowly increasing to a target of 12 to 16 milligrams of buprenorphine on day 7 or 8, at which time the opioid of choice for the patient is stopped. Clinical studies of this method of buprenorphine naloxone initiation have demonstrated improved patient satisfaction, decreased acute opioid withdrawal symptom severity, and, most importantly, improved retention and treatment. While large RCT studies are needed to solidify this approach to buprenorphine induction for OUD, supportive data continues to grow, and the American Society of Addiction Medicine has recognized the potential of this approach. We have used microdosing of buprenorphine to transition patients from daily observed methadone to buprenorphine naloxone with fairly good success. New and innovative ways to improve uptake and reduce barriers to treatment continue to be needed to address the continuing opioid overdose epidemic. Microdosing buprenorphine naloxone may represent one such innovative approach. This prescribing tip is brought to you by the Southern Illinois University Edwardsville School of Pharmacy and the Illinois Prescription Monitoring Program.